one today. I'm going to introduce our speaker, Dr. Burke, and I'm really excited to introduce you to Dr. Burke. Dr. Burke was recently appointed Director of the World Health Organization's Collaborating Center here at Emory. It's the first one we've ever had, and he, in the last 2 months since the start of the year, stepped away as chairman of the Department of Physical Medicine and Rehab to lead this worldwide effort. And he's taken his time to come here and talk to you. He's done a lot of things. He graduated from the University of South Carolina, and he received specialty training in physiatry, physical medicine, and rehab at Louisiana State University, or LSU. He also started the Department of Physical Medicine at Harvard Medical School. That program is now ranked #2 in the United States. And he's been here at Emory for the last 16 years until stepping away, as I've just said so. He's been named one of Atlanta's top doctors for physical medicine and rehab, and he has a monthly journal called the Journal of Bones and Brain in Review, which has been adopted by the National and International Medical Societies as a journal of note for the World Health Organization and most widely read in the world. So at this time, I'd like Dr. Burke to come forward.
Dr. Parker. So anyway, this is the new crisis is upon us and it's growing. So we know COVID-19 is going to be around, but it's going to be just another one of the flus that comes every season. And but the new crisis is declared by the WHO is going to affect everybody in this room. And again, it's important to me because my field has taken the lead in this. And nobody knows what a physiatrist is. I've been called a podiatrist, a psychiatrist, and a physical therapist, but we are the specialty that cares for the brain and the machine that carries the brain through life. You can imagine that it is the brain sends out electrical signals through the nerves of the spine and the arms and hands, and then the body responds. And that's my specialty. So anything along that line that gets hurt, and my specialty is brain injury, is in my purview. So I had somebody try to give a picture of what we do, and I wasn't real pleased with this, but it shows that the brain and the body working together. So when you stroke and spinal cord injury, back pain, come clipping in my office, I'll inject you with something. So anyway, so again, it's the brain and the machine. That's what I do. But the WHO's declared this emergency because between 2015 and 2050, people age 60 and over, and a couple of you here, I understand, have nearly doubled from 12 to 22%. Number over 80 years of age is expected to triple. And these years, as we found, as you add years to life, you're not adding healthy years to life in general. Most of those are added to poor health. And so we found that on average, on this planet, people will live 73.3 years, but you will be healthy only 63.7 years. And then you get a disability. And disability will be something that keeps you from doing what you want. And as the planet ages and it's aging rapidly, this is going to overwhelm healthcare systems. The United States cannot handle the current system. I put Japan up there because they know in 5 years, if everybody that works in Japan quit their job, there will not be enough people to take care of the elderly who need care. So that's why they are leading in building the robots. And so I've been working with Toyota and others to build robots to help us. You might find in a few years that we're going to have a nurse's aide coming to your room that is built by Toyota. It'll be reliable. We've got them programmed so they won't be smoking cigarettes out back. So anyway, because of the aging, because it's overcoming, I named this the silver tsunami. You won't hear this anywhere else. In fact, I'll say a lot of things you won't hear anywhere else. Everything I'm trying to tell you is science-based. And so we know the Grim Reaper is coming, right? You've always known. Nobody gets out of this alive. Everybody knows it, right? But the Grim Disabled is, I've had this artificial intelligence draw this for me, the guy that puts you in jail and keeps you from doing what you want to do. And that's the guy that we want to keep away as long as we can. We don't want to meet him before we meet the reach. So that's my job. That's our job now. And he, who's this grim guy that Dick Saber looking for? He's looking for anybody over 60 years of age. And so this is the stat. It really begins to shoot up after 60, and then just begins to climb further and further up until you can't do any what you want to do. So things that are in his toolbox, stroke and heart attack. I'll talk about those. Memory loss, which Alzheimer's is the big one, got everybody's attention, but that's not all. It's not all Alzheimer's, and they're looking for that magic pill to solve Alzheimer's. You can protect your memory and make it better now with technology now, medicines now, and we'll talk about some of that. Nerve pain, blood pressure, blood sugar, inflammation. You've heard about inflammation, right? Everybody talks about it. If I say it's like the weather, nobody knows, but nobody does anything about it. It's the inflammation in your body, it's important, but it's too confusing, so I'm not going to focus on that. And then there's disuse, when you can't, or don't feel like it, you don't, and you start to deteriorate just from not doing it. So it's the blood vessels. I mean, if you could just say it's one thing, I'm going to take care of my blood vessels, that is going to take you a long way. You think about the blood vessels causing stroke, heart attack, but the blood vessels, if you look, inject dye in the carotid arteries, and it flows through the system. It looks like a weeping willow tree. And at the very end, you get these small little blood vessels. And where your memory is, where your concentration is, and so, you fill them up with, you get McDonald's French fries stuck in one, some fried chicken in another, and pretty soon, you start talking like Grandpa did, like calling the kids the wrong name, getting where you're going, and you get in the car. But if you can keep those blood vessels clean, then you can keep this at bay. We think about the big ones, the heart attack, the stroke, but the stuff that eats us away capacity is these smaller vessels. So, so you want to keep your blood pressure. Everybody's got a different opinion, but the answer is 125 to 130. I read all the time. It depends on, but you can depends on and then not get a clear answer. But shoot for 130. If you're 125 to 130, then you're in great shape. The blood vessels won't be hurt. Blood sugar, hemoglobin A1C, less than 6. You'll get less than 7. But if you look at the data, bad things don't happen above 6. So, or below 6. So that's what you want. And tobacco abuse. It's just, you got to stop. Anybody smokes, gotta stop. Every cigarette you smoke, it takes 7 hours, it'll squeeze your blood vessels and get them tight. So that those little blood vessels where your memory is are robbed of their capacity. And if you smoke 3 a day, that takes the whole day. People, I only smoke a little. Like, oh, no, you smoke. It's bad. And it's hard to do. I mean, it's hard to quit. I know there's new techniques, but of course they're hard to get to, hard to get the insurance to pay for them, all of that stuff. And again, inflammation. Inflammation is important, but I think it's hard to look at what can cause you to reduce your inflammation. So I will skip that. So the answer, I just want to tell you guys things to do. The Mediterranean diet. About 5 years ago, I bought every one of my children the Mediterranean diet for beginners. And it's a cookbook, and they were interested in it. My son paid for basketball at Division I school. He was very interested in all I had to say about nutrition and health and getting his muscles stronger. But they took it to heart, and they have started to cook in a way that is really admirable. And it's hard to say what a Mediterranean diet is until you get and see what combination of things you do. But, I just, one of the things I simplify, Dr. Parker's got complete vegetarian, but that's hard to do. I grew up in Kansas, and if there wasn't a piece of cow on my plate, it wasn't dinner. I was I'm eating tonight, Mom. Like back in the day, right? So if you're gonna get a meat, if it swims, it's great. So if it flies, it's okay. If it moves, you should stay away from it. Anything that moves or anything comes out of a moving animal, stay away from it. All right? So, you know, and you all know the story of Oscar Mayer. Everybody, do you have the unabridged Bible? The big one, right? But you know, for those who don't know, in the extended Bible, when Moses was bringing the tablets down the mountain, on the other side, Oscar Mayer was bringing cold cuts. and they have been tormenting us ever since. So anything is processed, you know, anybody who's a hunter here, you've never seen a bologna in the woods, right? I was out in the woods last weekend. I haven't seen bologna. So, you know, the Mediterranean diet also has olive oil as the only thing. And, you know, they discovered the Mediterranean diet on the island of Crete in the Mediterranean Sea. And, you know, after a while, they began to think, these guys never have heart attacks or strokes. What's going on? So they finally figured out, oh, this is what they're eating. So they wrote it all down, watched them, and the traditional Mediterranean diet is 1 cup of olive oil a day. Yeah, and they drink it. You know the Italian restaurants, they'll pour a little bit there, but then you take white bread, sop it out, undoes the whole thing, right? So, you know, so my wife's always saying, that's a lot of oil, you know, but so I pour it on, boy. And alcohol, you know, get conflicting views about alcohol. And doctors will not tell you this because they're afraid, because 10% of people will go off the deep end. Right? It's like, you know, oh, yeah, that amount, okay. And did he say 2/5 a day? No. But the data shows that 1 serving a day for women, 2 servings a day for men will protect your brain and your liver. So, yeah, but newsflash is America forgot what a serving looks like, right? You gotta look it up, right? And people say, you know, oh, red wine, any alcohol, that's gonna be a serving. So serving tequila is a whole lot different than serving beer. So, you know, the fermentation process is good. So drinking things is good. And vegetables. I mean, I've often talked about fresh vegetables. Everybody talks, you know, like tells you how to eat as if you have nothing else to do, right? You go to the market every day, get fresh vegetables, figure it out, right? Americans especially don't have time to do that. So how do you do it? And one of the solutions is a guy named Birdseye was up way north. He was kind of running away from the family, and he found if he could step outside of his tent, it would freeze in like 30 seconds. And it tastes great. And then as they looked, then he got back to the United States and said, oh man, this is terrible. This frozen vegetables are terrible. So they figured out fast freezing will preserve the taste and will preserve the nutrition. So there's a rule of thumb: if you get 5 colors on your plate, then you're good. And so since I have started on the sabbatical, my wife is subject to my cooking in the morning. And I just got a frozen thing of vegetables with multiple different kinds, strawberries, lots of olive oil, lots of spices, and that's our breakfast every morning. So we get all the vegetables we need in the morning, and it's great. Go to other countries, and they don't eat what we eat in the morning. You know, if you ever get in another country and you got some scrambled eggs from them, man, they're runny, they got no. Anyway, the 5 colors on your plate, avoid white. You know, because you want just general. White stuff bad. I'm talking food. That's right. So very, when I'm with my patients and with my especially brain injury, I'm very brain. I say, you get all of this stuff swirling around. Oh, I heard somebody told me that. Let me give you some quick ones. I put the little asterisk by the important ones. I put the Mediterranean diet, of course. It takes a little learning, but green tea. If you one water bottle, that's 250 cc's. Green tea, that is as much medicine as we need from the green tea. They did, they've been able to study green tea very well because the Asians drink green tea. There's a lot of those guys. And so give them small and more green tea you drink, up into 250, the healthier you are. The English are behind us, so black tea is maybe as helpful, but to drink this green tea today, we have a case of that stuff from Costco. Green tea, that's what we take to the gym with us for green. So black coffee, 2 to 5 cups a day. Remember, nothing that has mood can so it's got to be black coffee, 2 to 5 cups a day. Caffeinated. Remember Sanka? Does anybody remember Sanka? Oh yeah. Decaf. Well, that's healthy, right? And that, so we got, and people at the coffee, oh, that better be decaf, right? The nurses still get, is that decaf coffee? No, because we found out that the decaf coffee was bad for you. And it deteriorated your health. And what we found out is they were taking the caffeine out by pushing the chemicals in, and those chemicals were causing us health problems. So now you'll see on decaf, it'll say water processed. It'll say, essentially, that says we won't poison you with. So that's very common. The third turmeric, people heard turmeric? Curcumin, I mean, this, things going fast, There was ginkgo for a while. Ginkgo was in everything for a while. But curcumin, turmeric, it is a very good spice. But if you eat some, it won't get into your body. It'll go right through. And so you have to put something with it. Olive oil or black pepper usually. But there's a way to get it into your brain to slow down the deterioration caused by inflammation. So 100 milligrams twice a day. This is not a brand, it's a way of processing it. It will get into your brain and it will help slow down the processes that cause the deterioration that we call dementia. So you ask, well, after my speech, what do you have in your desk? I've got this, and my wife read up. I'm editor of medical journals. So I've got 100 medical articles on my desk at all times, and this stuff has been progressively tried to see the patterns in it. It's good. So I have 100 milligrams twice a day. It's good for your joints as well, but again, my favorite is the brain. The sauna. This was a surprise. Huge study, and a lot of people, in Finland, they have more saunas than people. It's like guns in America, right? So what they found out is that the traditional Finnish sauna, and people, there's this fad of like ultraviolet or nuclear or something, but it's a Finnish sauna, the ones where in the gangster movies, the guys are plotting who they're going to whack the next time. So Italians are sitting there, sitting in the sauna for 20 minutes, 4 to 5 times a week, will lower your risk of dementia or cognitive decline by 40%. So I told my wife, man, I'm going into high gear workouts. I'm going to take a glass of wine down to the sauna. It's like Olympic training. So it's also something, and this is a great group to talk to about this. There is the idea about socialization, but and taking help and giving help. The phrase is it's better to give than to receive. But for your health, it's better to give and receive. So you have to accept and give, and there's great science behind that. So being part of a social network is a wonderful thing. So I'm preaching to the choir here. But other is strength. When people, you go to a trainer, or therapist, and you say, I just got to get stronger. They'll give you like 500 exercises, everything, the finger, everything. They miss the big stuff. So the key to life is just one group of muscles, and that is put your hands like this and stand up. And that, how How well can you do that? That's the key. Those are the muscles you need to strengthen. So my recommendation always is get on leg press. You want to be able to press twice your body weight. You go, oh, these guys, we gotta be careful. And that's a fight I've had with the therapist for years, is that this formula does not change no matter how old you are. So there is a formula where you say this is how you get stronger, and this is how you progress, and there's no deviation based on your age. So don't let them go. There's a silver sneakers thing. My dad got back from his workout at the silver sneakers, 90 years old. He said, we're doing weight training today. And I said, how much weight? He said, 2 pounds. I said, Dad, I know you have cufflinks in that drawer. That's not weight training. Oh, yeah. So this is my nemesis, Dr. Google. This is another one. This morning I just said, draw me a picture of a goofy looking doctor that looks a little crazy. And this is the guy that's selling you the natural stuff. And you'll hear all this stuff. And there's the Sunday morning programs where it's usually a chiropractor. She's talking crazy stuff. Or you go to GMC. I say the only way you can get lied to more than Washington, D.C. is to go to the GMC. What's this one do? I don't make the call. Yeah. Anyway, so you'll hear things like it'll boost your immune system. That's my favorite. Like, what does that mean? What does that mean? What you'll hear it. This week. You'll hear it. I think this will boost my immune system. And all natural. I tell people, well, our steak's all natural, but I'm not putting it on my burger. So you gotta be careful. Anti-inflammatory. And then I like what doctors don't want you to know. My wife was so disappointed when we got married that there was nothing that I didn't want everybody to know. There was no secrets that, other than general anesthesia. I should say that before I finish. That we know that general anesthesia will cause you brain damage. So it's a very simple thing. If a man walks into the room, puts on a mask, takes out a knife, don't go to sleep. Especially when you get older than 80, you may not recover. My father never recovered, and I think that's what killed him. He had a broken hip. And my father-in-law had heart surgery, and I told him, this is the only danger. And he, just got a little loopy and then just went off the deep end. And then finally, my mother-in-law then broke her arm. And I said, get me to the surgeon. So he said, well, we don't usually do general or local anesthesia. And I said, well, in this case, I wish you would. And so he said, well, we don't usually. And I said, but you're going to do it this one, right? Yeah. So anyway, she was fine. You can get local on almost everything. Not heart surgery perhaps, but if you break something, ACL tears, you can get the local, and then you don't get that damage. So anyway, and I think that's the one thing doctors don't tell you, especially the surgeons, right? Meniscal tears is another one. I should say. I've been in martial arts for 40 years, and so I've had 4 knee surgeries. All my right knee, ACL repair, then they whittled on it back and forth and over the years. And what they found is that when you have a meniscus tear, right? Anybody had a meniscal tear? Yeah? They sewed it? Yes. They sewed it. So like a real nerd, I took my New England Journal of Medicine to read in the recovery room after recovery from my meniscal surgery. And there was the first article of many to come that says meniscal surgery will make you worse. It won't. At first, it won't help. Then it'll make you worse. So it won't help. They're like, the surgeons come by and say, Tom, don't read that. New England Journal of Medicine, right? So anyway, what is coming is a great array of things that you can monitor yourself at home. And again, blood pressure, blood sugar, if you get those under control, then you have really made it a long way. I think it's hard to get into a doctor. My wife was trying to get an appointment. She ended up going to North Side because she couldn't figure out the system here. I mean, and then she had to wait for months. And so it's very difficult, but what's coming, and one of the things I'm working on is a way to have people monitor from home and then send medicines, check them, send medicines without ever leaving your house, so that we can adjust those over time. And so, there is a blood sugar monitor, blood pressure monitors that are coming. They're not completely perfected yet, but they're coming. They're coming. And I was talking to the engineer yesterday, just hoping that they'd had some studies that showed that they were perfect. But if they can monitor and then tell you exactly what your doctor exactly what to prescribe, then you're a long way towards being healthy for a long period of time. And Dr. Parker mentioned that you guys are. Well, it was a depressing thing. Like you guys are screwed. You're gonna get sick. You're not gonna recover. All this stuff. But if you control these few things: blood pressure, blood sugar, diet, then it's amazing you can extend the period of time before anything bad happens to you. So I think this is all coming along with the self-driving cars. That scares people. That's I see that as a godsend. Elon Musk is putting 32,000 satellites in the air so that he can see everything, and those cars can be very accurate. They'll pick you up at the front door, drop you off. There's even a program going on that they'll go out and do Uber and make you some money while you're at your appointment. That's true. See how many tips your car got, right? So anyway, focus on the few. Just focus on the very few. There's I just installed a radar in the hospital, the rehab hospital, to show where everything and everybody is in 3D space. And so you can watch. Now, if you got elderly parents, you're worried, I don't want to leave them alone, worried what they might be doing, there's going to be monitors. You can watch this. And I put this monitor on my father in Austin, Texas, and we had the radar, we could just see. And I looked at the data one morning. I said, Dad's walking slower and his gait is wider. I said, so I asked my sister, go check on Dad, see what's going on. She said, well, he's talking a little slower. Yeah, I don't see him. He said he doesn't feel sick. My dad never complained of anything. But I looked back, I said, I bet he's getting a bladder infection again. I sent in antibiotics, and then we called his doctor. 3 days later, he gets into the doctor, and they go, you've got a bladder infection. And my sister said he's been on antibiotics for 3 days, so he never got sick. But the bladder infection before had him in intensive care units, and he was calling me $35,000 a day. Is this real? There's something wrong here. Yeah, really wrong. Yeah, but that's the way it goes. So, and as far as making the home safe for anybody who's not perfectly fit, an occupational therapist, once in the home, there are things that they can do, look at to make the home safer. And it's like a 40% reduction in falls. And falls are what, when you're over 80, falls are one of the deadliest things you'll come up against. Even worse than the guy in the mask with the knife. This is a little out of place, but the Surgeon General, about the time that this international crisis was declared, said that because of COVID, we've gone over the edge and there is a crisis of social isolation. So if you don't isolate, if you don't get out, and a lot of people they just won't go out anymore. They're kind of scared of the bugs, and they stay away and they get lonely and isolated. And he said, the data that he came up with is if you feel that your social connection is lost, if you feel lonely, the risk of premature death goes way up, and it's equal to 15 cigarettes a day. So staying in them. Now, they're just hiding from the cooties now. They're totally open, but that's an enormous thing. So again, giving and receiving. My wife's a therapist over at the Mild Cognitive Impairment program, and she had a program where they come and make these blankets as a group, and some of them are pre-Alzheimer's. They make the blankets, And then they take them to Children's Hospital and give them to the kids who have been in the hospital for a long time. So they're doing both. They're getting help over there and giving help to the children. So that's a great thing. So, and another thing is, you got a kid, stay active. I mean, don't accept restrictions unless you absolutely must. And be careful when people tell you to be careful. Now, yeah. So now there's some women in the room. I want to do some exercise with the women. Can you do this? Women, and do this up against your ears. Okay, guys. I have treated people all over the world. When I worked at Harvard, people flying in from Europe to my clinic. I mean, all over the world, it's the same thing. The women say, slow down, stop, sit down, relax, and tell the men to stop moving. I mean, and you get it at home, right? There was a little of that stuff from Dr. Parker, I think. Just take care of her husband, but it's men don't sit well, and relax. I don't know. I've been married, over 30 years, and I don't know how many times I told my wife I don't relax sitting still. And one of the more frightening experiences I ever have is sitting with her family at a dinner table, and we're done eating. And an hour goes by, and I'm hearing about how so-and-so did since high school, and I never heard of them. Anyway, so they will say, sit, relax, don't go out, don't do anything in the yard. I mean, go as much as you can. Don't stop driving. There's another thing. Take the keys away. Why? If anybody here has ever ridden a motorcycle? Yeah, so you know how bad the drivers are, right? So people who are legally driving, I used to think the blue-haired ladies, the ones that get me, they're looking through the steering wheel like they have an aiming device. Those they let them out. Yeah, go drive. They just my friend's got his mother's 93. They gave her a 5-year license in Kansas. 5 years. So you get a little sick in the hospital. They say, "Oh well, we would take your keys away." The kids love it. I had a man here who came with 3 grown daughters every time, and he had a stroke, but he was doing okay. But they were like, "Oh, Dad, she's got to stay still. He can't leave his room." I said, "Let me ask the boss here, Mr. Jones, what's your number one problem?" He goes, "I got too many goddamn women telling me what to do." That's a good smile. Anyway, say that. I just take some pictures. My kids know I like stay active. So for my 62nd birthday, they did motocross bikes out in this place, and so we went off in the woods and had a great time. And just doing different things and active things. I think you'll get not able to do something. I used to do free climbing, mountain climbing without ropes, not because I'm crazy, but because I couldn't afford them. And I'm in graduate school. So after my second knee surgery, I was on the side of the mountain and my knee gave just a little, and I slid a little bit, and it was like certain death. That's it, done. Never went back. So, but a lot of other things are good, I did the eagle because I love taking photographs out in the woods. So there's a picture of a guy that watches me fish and laughs at me about how bad I am. So anyway, that's all. I just want to give you a few simple things, but that's it. I would just watch those things and stay active, and you'll do great. Now the moderator.
Thank you so much. Really enjoyed your lively and colorful presentation.
All science, all science. I know you guys, there was a lot of questions that came before. I wrote all the answers out, sent them to them. Back in somewhere.
again, we have an excellent presentation. We also have, so we've got two docs in the house today. Dr. Trimble, stand up and he's back with us today also. Love it. So I know you guys have a lot of great questions for Dr. Burke. I've seen some of them here, but I just wanted to start out with one because I thought this was kind of interesting. Stay away from everything white. So does sugar play a role in causing arthritis?
You know, that's a very difficult one. I think added sugar, most of the sugar in the diet, by the way, is processed foods. You know, even cigarettes have sugar in them. So it's not the one stuff you sprinkle from your table, but it's the other stuff that's already in the foods that gets you. And so there is some thought that sugar, among the other things, causes some inflammation, which may reach your joints. Just there's many reasons not to overindulge in sugar.
Okay.
I guess that's one of them. But
Excellent.
if you stop eating sugar, you're gonna have to do something else with the arthritis.
So I've got the mic. Here's what we're going to do. We're going to work from one side of the room to the other. So Mr. Robertson right there has got a mic for this side, and I'm going to come over here. So by show of hands, just your questions. Make sure, by the way, just housekeeping notes, that you form your question in the form of a question rather than commentary. We want to get the most out of the doctor while he's in the house today. And so we'll have other times for commentary, but right now we just want to take your questions so we can give him the benefit of giving us good information. Right here.
Oh, yeah, I just wanted to ask you, there are a lot of doctors out there, not I broke the mic. A lot of doctors, not just naturopathic doctors, who talked about all the things you said about diet that will repair atrophy of the brain, not just suspend it. What's your opinion about that? And then also, to what extent does hearing loss contribute to Alzheimer's?
I'll go with the first. Well, the second one, hearing loss, we know that your IQ will go down as your hearing goes down. Same with vision. If you can't interact well with the world, it slows your brain down. You need to be actively engaged. And I think that's one of the things I said. And I've lost the first one already. Yes. Oh, okay. Can the brain grow back? When I went to med school, there was no way. But now there is something called neuroplasticity, where brain tissue can generate where there wasn't any. And there's different ways to try to stimulate that. And so stopping the poison doesn't necessarily stimulate the brain to do things, but there are ways to get the brain working. And one of the things down this hall, there's something called TMS, transcranial magnetic stimulation. We know that certain magnetic currents can help regrow brain tissue if you do them right. There's different stimulation techniques. One with like a 9-volt battery called DCS, and then there's a vagus nerve stimulation, and all of those have been demonstrated to help your brain improve. In fact, there's nowhere in town I couldn't find anywhere that was doing direct current stimulation, which I'm fond of because it's a fairly cheap machine and does great things. And so I had my son go off. I still have connections at Harvard, and he learned it for a summer internship, came back and started a clinic. And just amazing things with that clinic. Even, if you don't have any trouble, it'll help improve your memory. But it's not covered by insurance. Not many people know, it'll just kind of fade away. So, not deteriorating your brain with poison is the first step, but to actually get it to respond and go the other way is more difficult, more focused. So there are ways, but.
Okay, next question.
Uh-oh.
As far as anesthesia is concerned,
Yes.
I know the gas has a lot of bad symptoms,
Yes.
but what about Prothol?
Oh, well, that's what Michael Jackson took, right? He's still sleeping.
Okay. One more question.
What is the buildup of earwax indicative of? Or is it indicative of anything?
Boy, that's it's close to the brain, but I don't know of anything that that I can think of that is brain related that it's indicative of. I know, I know you have to be careful it doesn't interfere with your hearing, because that then begins to slow down your capacity to interact with the world. But I don't know. I don't know of anything that say, oh, geez, you got earwax. That means you've got, Parkinson's disease, something like that. I don't know of any. There might be a correlation somewhere, but I don't know of it.
Yeah, Dr. Burke, so my question is on another level. I have a lot of brothers back home who were in Nam, came back because they were on heroin, came back and smoked crack. So my question is, versus those individuals who were long-term dope fiends or whatever you want to call them, on cocaine or crack, how does that really affect your brain?
Well, it depends on how much they did at any one time. I mean, whether they were doing damage or just slowing down their brains for the time being. So that's hard because some of those things will interfere with the blood flow to your brain and will actually damage some tissue. But but some things come and go and aren't that bad. That's a very difficult thing to say because there's no research where they say, okay, we're gonna these 30 guys, we're gonna give crack to 3 times a day. And these guys, we're going to give them a placebo and see what happens. So we know it's usually associated with other things that aren't healthy, like not eating well. Some of the damage to the brain could be a nutritional deficit at times, or an oxygen deficit. So it's hard to say, but it's something if they stop, things will get better. And again, it depends on the injury. It's hard to.
Okay.
So vague.
Okay.
Yes, do the word puzzles help your mind?
Oh, there we go. I love this. I love this because I read way too much. And so there are many companies that are starting out that have said, if you do this, the computer thing, your brain will get better. And there's many of them, you'll see people doing them, so that you can see, that stuff where I'm doing the cool stuff and you're not. And so they did a study and compared them all. And the one that came out best for preserving your brain was the New York Times crossword puzzle, middle level. And it was sponsored by one of those companies that's just spent $1 billion on their software, and the crossword puzzle beat it out. There you go.
Excellent. One question here.
Yes, doctor, you told us about the importance of drinking olive oil.
Yes.
What's the minimum amount of olive oil once you drink? And again, what joints and organs is drinking olive oil good for?
Yeah, the minimum, that's, because I said, a cup a day is what they drink in the Cretan diet. I don't know that that's been measured. So I know a daily dose, but I think, I know 2 tablespoons has been trialed in some studies of 2 tablespoons per serving. But I don't know that they measured exactly, how much they did. A lot of these studies are done over populations, and they say, let's watch what they eat and then see whether they deteriorate, and look and see of all the guys that do this, how do they fare, and just look at the different ways. And there's mathematical ways to pull out the effects of other things. And the 2 tablespoons a day is the only one I saw that, but so 2 tablespoons and it's up to a cup. But I mean, if you're generous with it, I mean, I do, the olive oil on the grilled vegetables, and then you can put turmeric on it, and, some spices, it's good. But yes, sir.
Okay.
That's not the,
Yeah.
that's not the brain I'm specialized in.
So
We got a question here.
we've got one question on
question.
this side, and then
Okay.
we're gonna,
Here we go. Here we go.
yeah.
Here we go. Hold on.
You should have been here last month. We talked about that.
Go ahead, sir.
Dr. Burke, thank you for your presentation. Does tinnitus, ringing of your ears, affect your brain?
Oh, yeah, you wrote that question, right? And, yeah, I mean, and the ones for, the right to send in first. That's a very interesting question. Now, tinnitus, ringing in the ears is one of the more aggravating things in medicine, and for people who have it. Tinnitus can be caused by a number of things, and most of the time, doctors can't figure it out. Now, one thing that tinnitus comes from that I specialize in, when people are in a car accident and they go forward and you end up tearing some muscles in your brain, then there is a nerve that goes, a small branch that goes to the ear. And sometimes I'll get people who feel like they're clogged or they get some ringing in there. And then you can calm that area down, some steroid injections, and try to get that from forming scar tissue and stop that. But, but tinnitus doesn't cause injury to the brain. It's aggravating. And some people it's so bad that people talk about going insane by the ringing in it, but there's no direct damage to the brain. It's just, it's a variety of things that can cause it, and it doesn't then cause a deterioration of the brain. It's a symptom of something else, not a cause of something bad.
Okay.
This next question is for Dr. Trimble.
Doc, how do we get smarter about choosing what to read? There's so much out here. We can read too much, so much. Now you can tell me, the Emory programs, yeah, we can get involved in those, but I'm not going to ask you what do you read, but if I want to stay on top of this, or if I want to stay engaged in this, how do I get smarter about picking what I want to read?
You sure you want to ask me? Because I can't even turn the microphone on. That's a great question. And I'll tell you what I read personally. I love history. I like philosophy. I like political history in particular, because I see things being repeated. Professionally, of course, I read a lot of literature so that I can come and answer all of these questions and do good work for my community. Now,
Okay.
I think what you're trying to get at is sources of information to take in. Is that the heart of what you're asking? Of medical information?
Of how to avoid
Yeah. There are just, yeah, I do. I get it now. There are a few news sites that report health. Medscape is one news site that I like to look at. But then you have the task of filtering junk science or things that are designed to invoke emotional responses. But for health, I primarily go to Medscape for the general public. Is that perfect?
Yeah. And then the other thing too, I think, is anything that keep us engaged.
Yeah.
from a intellectual, mental level is also very helpful. I find that to be very helpful too. So yeah, from like history, oh, we love that. So we've got a
Okay,
couple
one
more
more.
questions, one on this side, and then we've got a time for two more questions. Thank you. You want to continue?
Dr. Burke.
There's also a site, blackdoctor.org, blackdoctor.org.
Thank you.
Dr. Burke, over here to your right. So we've all lived through reefer madness and now find that THC may have some medicinal benefits for all, Parkinson's and things like that. Does it help with Alzheimer's and any other brain health disease or issues?
I think the THC, but I think one thing about the marijuana issue is inhaling hot gases into your lungs is always bad for you. But you're talking about the THC, and I know there's all sorts of stuff that's coming out now that it's legalized in a lot of places. I don't know that the science has been good enough because what they were testing was different. They didn't control for it, so there'd be this different formulas, and you had all sorts of different answers from the data. So what I think I can generally conclude from what I've read so far is that THC will reduce your motivation to excel in life. And so be careful you don't do it on the way to the office.
Excellent. So look, we have time for a couple of more questions, but just by a show of applause, Dr. Burke, he's going to be back. We got to have him back, right? You now our brother from another mother. we love you. So what we're going to do is we're going to get two more questions, one here and one with Dr. Gray, Mr. Gray's over here, and then we're going to conclude our Q&A. Right here, this gentleman had a question. What's your name?
My name is Julius Smith. Dr. Burke, I noticed you had Tai Chi as one of your recommended activities. What are the benefits of that activity?
Tai Chi has won out on the exercises to help with balance and to prevent falls. And if you think about, have you ever seen Tai Chi practiced? It's from a crouched position. So I talked about sit to stand, right? That's the secret to life. Sit to be able. That's why it would. When I've been invited to speak in China. No, they do that in the morning. 80, 90 years old, they're all out there doing it. So it's a great exercise.
Okay, one more question.
Dr. Burke, you said that the third sermon, if you took it, it went straight through you. Yeah, okay. Sumerian, okay. Well, I went to Dr. Google to try to find some, but my question is, these capsules sort on Amazon. So what is the best method or best source of getting this?
Well, knowing that there was knowing that the 100 milligram tablets was the good dose. 100 milligrams twice a day is what the research says is good. So there are very few places that have 100 milligram tablets, and that was it. So Swanson's had a 100 milligram tablet, And so I had a bottle of Swanson's 100 milligram tablets in every one of the kids' Christmas stockings one year.
And is it something you're supposed to take with it?
No, well, water so you don't gag on it.
All right.
Listen. Well, again, this has been an excellent presentation. Give him some love, Dr. Burke. We really appreciate you for coming by, and we really appreciate your presentation and answering those questions prior to, coming in today. So thank you so much, and we appreciate you. We're going to have Dr. Trimble come up and give some closing remarks, and then we will be doing some exercises with John. We're going to practice what we preach, okay?
I always love coming here because you guys ask the best questions.
Yeah.
You really do. You ask the best questions and it shows that you're really informed and that you have an interest in your health. So I absolutely love that. One thing I want to say, when it comes to marijuana or THC, you have to be careful because you don't know what's in it. I've had a few friends who passed away recently because fentanyl was in it. Yeah, so just be very careful about that. Overall, when it comes to your information, you have to pay attention to your physical diet, but also your mental diet. All right, so both in combination are important to long-lasting and a high quality of life as you get older. So coming here is a good place to get good information, and what you eat can help your body. So the question about sugar, there was a really large study done in Brazil. And I find it interesting because, Brazil has a large population of people of African descent. And what they did is they looked over time at people who ate a lot of processed food and compared it to those who did not. And they looked at how well their memory functioned, how well it worked over time. I see a bunch of cues. Oh, okay. No. So, all right. So anyway, over time, adults who ate a lot of processed food, they started where people who ate healthy diets ended, right? So it's not just inflammation, it's brain effects because your body has to clear all of that stuff. And as you get older, your body can't clear it as efficiently. It just gets stuck there. And that can affect how well you remember information. Last point. I love the question about Tai Chi because Tai Chi is like moving meditation, right? It's concentrating on something. So to meditate, you have to concentrate. Concentration over time is meditation. You've heard of mindfulness. Well, that's focusing on what you're doing like in this waking state on some activity. Meditation is focusing on what you're doing in an inward sense without a lot of input. So what happens with Tai Chi is you're focusing on the activity and you're building your brain, you're stimulating it by forcing it to concentrate. So it does have a very positive effect. I encourage you to do it.
Excellent.
And just avoid the marijuana. You don't know what's in it. So THC.
Yeah.
THC. All right.
Excellent. Thank you so much. Give him a round of applause. It's always good to have a couple of doctors here. We want to thank you guys for coming out and representing your team and your gear today.